Welcome to video lecture number 4 for chapter 15. In this lecture, we are going to cover bacterial infections of the skin, collagen-related diseases, and some other skin diseases and skin manifestations. Staphylococcus aureus, which is also commonly known as staph, is the most common bacteria that invades the skin and is the cause for a lot of different issues. They can cause pimples, they can cause boils, they can cause carbuncles, and they can cause impetigo. And what happens is that bacteria infects the hair follicles and the surrounding tissues to produce something called furuncles and carbuncles. So furuncles is the infection of the actual hair follicle itself, which then spreads to the tissues surrounding it. And a carbuncle is just a bunch of furuncles together, and it usually happens in the back of the neck. Staph can cause things like cellulitis of the epidermis and the dermis, so that's just inflammation of those layers of the skin. Necrotizing fasciitis is caused when some strains of staph and strep produce enzymes that are very toxic and digest the connective tissues and then spread into the muscle layers. So this is a picture of what this type of bacteria can do. Obviously that the genus necrotizing means that it does kill the tissues that it invades. So this is a very serious bacterial infection. Now we're going to move into collagen-related diseases. And remember that collagen is a fibrous protein that makes up about a third of your total body protein. So collagen-related diseases are going to have a really dramatic effect all over the body. The first one we are going to talk about is rosacea. Rosacea produces a facial rash, and the underlying capillaries become enlarged and show through the skin. It is thought to be worsened when the person suffering from rosacea drinks alcohol or eats spicy foods, but its origins are unknown and it has no systemic complications. The second collagen disease we're going to talk about is scleroderma. Scleroderma is a chronic persistent autoimmune disease that occurs more often in women than men and is characterized by hardening and shrinking of the skin that makes it feel really leathery. Some symptoms of scleroderma are that the joints show swelling, they usually become painful and stiff. Your internal organs like your heart, lungs, and kidneys and your digestive tract can be involved in a similar process as this, and just like rosacea, the origin of scleroderma is completely unknown and there is no effective treatment at all. Some other diseases of the skin, these don't have to do with collagen. The first is psoriasis. Psoriasis is marked by itchy, flaky, red patches of the skin like you see on the individual in the picture. It appears most commonly on the scalp, eyebrows, and knees, and again, its cause is completely unknown, which usually makes it very hard to treat. Vitiligo is a skin disease that produces pale, irregular patches of skin that have no pigment in them. I think this is becoming a more and more common skin disease. I know my uncle is dealing with this, where you just start seeing these white patches of skin all over your body and then it seems to kind of spread. So the white patches have no melanin in them. Skin is actually a really good way to look for other internal diseases you might be dealing with that you don't know about. So, for instance, cancer is one of those things that you can use your skin to help you figure out whether you have it or not before you are actually diagnosed. So signs of the presence of cancer inside the body are often shown by skin lesions, even before the cancer has actually produced symptoms or it has been diagnosed. So dermatomyositis, which means inflammation of skin and muscles, is often one of those skin diseases that is a precursor to cancer. So it's often associated with ovarian cancer in females, which can appear within 4 to 5 years after the skin disease is diagnosed. So keeping watch over your skin is a way for doctors to catch cancer maybe before it gets bad for you. And that is going to be it for video lecture number 4.